Hello, everyone. Can you hear me?
Yes.
Yes.
Very good. I had multiple messages from the participants that were all traveling on Saturday, the 10th of July. So nearly 2/3 will join the recording, but not the webinar. So apologies from them. But well, anyway, we have an opportunity to talk more as we are together 1, 2, 3, 4, 5, 6, 7, I don't know how many of us today. And we're all ready to start. It's 12 o'clock, yeah? Good. So, did you enjoy your homework?
Yes.
Yeah, it's quite complicated. It looks complicated when you start, but when you carry on, it's okay. So, you have received the handouts.
Yes.
Yeah, which I will share with you because we will work with the handouts today. Let me just tune it and open them. So, and the preparation part will be done. Okay, doc. You may hear my lovely dogs, but they are here. They are closed. They can't go outside because the premises are painting. There are workers working around, so they can bark. But it's good. It's good. So I believe you put all the numbers of the points around the graphics, around the shapes, yeah? So it's very helpful in the clinic. Just carry on like this. Put it on the wall. And after a few days of work, you will stop thinking, you'll just do the conversion. Can I ask you, when we should avoid the conversion? In which cases you wouldn't do conversion, please?
Can I ask?
In local
Problems?
problems, yes.
Anything else?
When there isn't a whole meridian problems or
When you
general sickness.
General sickness, well, for heat, we do the conversion. We do for general sickness conversion.
Yeah.
In which case we would not do the conversion. As you said,
Besides local problems.
Local problems. Anything else? When you would do the global balance, like points, but not the conversion.
When there is more than one problem.
No.
Several problems.
You can do the conversion for several problems. It's okay. When you would not do the conversion. When you would avoid conversion. In which situation? I will give you the hint. For example, you need to tonify the digestive problems. You need tonification for gynecological, for digestion, for you would use the global balance without conversion. You would use 8+1 to tonify the digestive system. You would use the gynecological treatment, or in case of sickness, sinusitis, for example, yes? You will use the global balance, but the local points.
Yes.
Yes? Because there is a main difference between conversion and global balance with points. The conversion spreads the energy. It tunes the meridian, but it does not tonify. It spreads, it equalizes everything. Okay? It tunes meridian between themselves somehow on the Bagua, right?
Yes.
And if someone is very low energy, you just balance the low energy. It doesn't make sense. You understand?
Yes, yes.
Yes.
When we speak about, for example, Shao Yin, Shao Yang, yeah, Shao Yin. Oh, no, it doesn't work. Sorry, my drawing part stopped working. My apologies. Oh, the drawing, okay. I will use my, just a sec. Oh, which one? Doesn't, I changed the wire. I'm so sorry. Well, anyway, I will use my, so Shao Yin, Shao Yang, yeah, this button. If we treat the depression, my question is depression is the low energy? Yes and no. Depression is the condensed energy. It's all inside. They are tense because they do have this energy. It's just locked. You understand? And when you do this, Shao Yin, Shao Yang, you spread this energy, you open the box, okay? So it's great equalizer, the conversion. It tunes the whole system. But if you see the ear is pale and white. There is nothing there, no life. You see the hands, they are white, they pale, there is no strength. I wouldn't do the conversion in this case because it can bring the energy even more. You have to lift up the patient. So what would you do? You will use stomach 36 in global balance. For example, Ta Yin Yang Ning. You will use large intestine 4 just to make it working. Yeah. So you need to move the blood to tonify the organs to produce the blood. So this is what you need. But if you will spread the energy of the person who doesn't have the energy, it doesn't make sense. It will not feel better. Okay? So that was important to mention. Right. And today we start it's actually the 5 elements and seasonal balance is a present. It was a present to me because it allows to look deeper into the system, into the philosophy of the things. So the main idea behind is to level, to fit the wisdom of Bagua and acupuncture system. So we have to take the wisdom of Bagua and match it to acupuncture. Okay? So based on Bagua, we build up 2 approaches, and the first one will be 5 elements. So the 5 elements we learned at school. Yeah? So what did we learn? Let me go to the Chinese 5 element system. I just represented the main figure for 5 elements. And we all know how it works. For example, just to revise very briefly, the tonification circles, mother and child, that wood will feed the fire will give energy to earth, earth will feed the metal, metal to water, and water to the wood. Yeah? Agree. So, in order to move the earth up to give earth more energy, we may tonify the fire. Yeah. We can blindly tonify the earth, but we also can tonify the fire so the earth will have more energy. Right? How can we sedate the earth? Bring it down if there is too much earth? Any ideas? It's too much earth.
With the wood element.
Right. We can tonify wood. It's very strong invasion, by the way. So wood will bring down the earth. Yeah. Right. But what is milder reduction? How we would just gently reduce the earth?
Sedate and fire.
To sedate is difficult. It's easier to tonify.
Tonify water.
If we tonify metal, for example, what would happen? There will be too much metal. Too much metal will bring the earth down. Would you agree? And on your, in the diagram, in the tables, you will see the little minus. This is the interrelationships when the next element sedates the previous one. But we will come further to it. Just don't worry about it. There are so many relationships within these circles, we just highlight. So we will deal and we will discuss in more details the relationships between these elements during today, before the lunch. Okay? So we base this 5 elements approach in balance method on this game between the elements, on tonification and sedation. Okay? So imagine that situation is very clear. You know that the wood invades earth. What are the symptoms of the patient when the wood invades earth? How would you know, for example? It's a very common situation. Nearly like 30% of people have wood invading earth, yeah? What would be the system, the symptoms?
Digestive disorders.
Yeah, sometimes constipation, sometimes a diarrhea. Yes, it changes. What else? Wood invade,
Anxiety.
invade stomach, spleen. Very common. Anything else?
Anxiety.
Anxiety. Anxiety can be very, it can be for everything. Nowadays, COVID is anxiety. General anxiety. But what exactly made you think that spleen liver invades stomach, spleen?
IBS.
The redness on the tongue, yes. Anxiety, yes, but I would say the tension, not the anxiety. Liver gives the tension. These people are tense. They
Yes,
can't
yes.
relax. Yeah, they are stressed. Agree?
Yes.
Yes. So the pulse is very important because liver left guan must be strong and wiry and tight. And what would be the stomach position, right, guan? If wood invades stomach, spleen, it will be strong or weak? Weak, yes, because liver is overacting. So in this situation, you know exactly that there is disbalance between two elements, yeah? So in this situation, you can apply 5 elements approach. So I just illustrate that we must be sure that there is the disbalance between two elements, not the general sickness, or so we have to have a reason to apply 5 elements, right? That's why 5 elements. You have to know that there is a lot of fire, but no water, not much water. Or like in case of, for example, allergy, the metal, the wood invades the metal. The skin problem, for example, you know that there is so much wood and it brings the metal down. Okay, so there are relationships between main 2 elements. In this case, you use the 5 element system and it works very well. So we have to be skilled enough to see the problem of the element, but we will talk about it today. So how are you feeling with using antique points? Are you feeling comfortable or not yet?
Yes.
Coming back to our previous seminar with 12 magic points and conversions, so you feel comfortable using antique points within the system, yeah? And today we'll continue with the same practice. But before that, we will talk a little bit about the Bagua. We'll start. We won't speak about it in detail because I think this is the endless subject. The subject of Bagua is so broad and it's alive. Years ago, I did a lot of astrology, Chinese astrology, based on Bagua. And it is very precise. It's amazingly precise. Our treatments, acupuncture treatments, were also based on Bagua. Anyone tried kidney 247 in your practice? How did it work? Did you see any results? Any difference between just using the kidney 7 or kidney 247? We can't hear you. Switch on the microphone, please.
Yeah, I've been using it since I've learned Dr. Tan's method, but I'm not 100% sure of the improvement.
Yes. And today we will learn when we shouldn't use kidney 247, when we have to, and and other things. But the effectiveness of these points they based on Bagua relationships, which is an amazing. Just to highlight important things I will repeat because the material is very, very complicated. So I will highlight things. Normally after the seminar, people feel lost. So I don't want you to feel lost. That's why we will go slowly and step by step. I know that to listen is very difficult. It's much easier to talk. So please focus on certain things. You remember that when we started with system 1, we had our Fuxihua. And we had 2 distributions between meridians. First distribution was for the system 1, when we draw Jueying, like pericardium, liver for Jueying, we connected. So we draw Shaoyang, kidney, heart, we connected 2 channels into one and saw the relationships. Last time we jumped to ID, meridian ID, and we learned the different distribution between the meridians and guas. So here, for example, we can see the stomach ID and spleen ID, gallbladder and bladder ID, very young, yes, and liver and kidney, large intestine, small intestine and Senjiao, pericardium, heart, and lung. It's a revision, little revision. But today we'll deal with a different Bagua. It's completely different. We use it for Feng Shui. The distribution of trigrams is different. In Fuxihua, we can see the yang trigram, yang gua is in front of yin always. And the sum of the elements is 9. Here is, everything is different. We can't see yin in front of yang. We can see that half of the elements on the north belong to yin and half to yang. So it's different distribution. It's completely different gua. So different relationships. The Feng Shui, the Wenwang Bagua, we use mainly for seasonal balance and also for 5 elements. In this Bagua, we're staying outside of the circles. If in Fushigua, the man is inside, here the man is outside. So it's just looking from another room, okay? North is on the bottom. North was always the gate to the house. South is on the top, is the fire. And very important, not to confuse two very important things. We have the name of the gua and we have the name of the element. Now I will write it down. Everything in the black line is the name of the gua. Please remember, everything like fire, wind, thunder, mountain is the name, water, heaven is the name of the gua. And now we will write down the element. It's a different thing. Please don't confuse it. The main confusion comes from this. So on the bottom, we can see the north and the name of the gua is water. You remember when we discussed the system 1, it's a strong stream of water, very young bar between two yin. Water is mild, but very strong. And now, what element is water? Water belongs to water. Sorry, that will be difficult because my pod is not working. I think when I have a break, I will amend it, but it belongs to water. So water is the element. I will circle it. Is the element. Please remember, is the element. And which season, by the way, we will not write it down. What do you think? Is water? North? Winter. Not for people who live in Australia, but I mean, I'm talking about the cold or New Zealand, but water is winter. Okay, let's jump to the south. The name of the gua is fire. It is not the element now. But if we name the element, it will be also fire. In this case, it coincides. Fire, okay. So the name and the gua, name of the gua, are the same. But let's look at the West. West in Chinese medicine always associate with what? Who knows? Metal. Metal. And the season? Who remembers? Is water. Oh, autumn, sorry. The season is autumn. And there are two metal elements. The metal will be on the west, and northwest is metal as well, is the element. Okay. So we have two metals, but one metal is yang, which is Kyangwa, which is heaven, yes? And another metal is yin, is lake. How do we know that it's yin or yang? We count the yaos. 3 yaos is odd, so it's yang. It's yang metal. And Dui is yin metal. Okay? It's clear? Okay, let's go to the east. East is wood. Okay, so east is wood. So wood is the element. And southeast is wood as well. My goodness, such a beautiful writing. This what happens, you feel yourself like a child. This is how we did our drawings when we were 1 or 2 years old, I believe. Okay, so we have two woods. One wood is yang, which is thunder, which is zhen, and another wood is yin. Shun is yin, wind. Okay, and we have two transition seasons, and we relate it to earth. Earth, oh my goodness, earth. Gosh, it looks like Picasso, isn't it? Picasso pictures. This is what I'm drawing. And another earth. One earth is yin, another earth is yang. And now let's see the table. The table in your handouts. Look, all the elements. Now I will just clear. All the elements are here. The elements that we draw in the Bagua, I put it in here, into the table of I Ching. Can you see that? And now we will see how the Bagua matches I Ching hexagrams. There are 64 hexagrams in I Ching table. And this will be our working table for today. And we will base our treatments on 64 hexagrams. Isn't it wonderful? And in 2 hours, you will find it easy to do it. I can't hear your excitement, but I'm sure you are.
Very
Right. At the moment, we go very slow. So can you see all the elements here?
yes.
Yes.
On the top. So now we have the situation that we discussed. When wood invades earth. Yeah. would invade earth. So liver invades stomach, spleen. Very important. When we, in 5 elements, create the drawing of the Gua, on the top, we put the element which affects, which has a power. And on the bottom, we put the element which is affected. For example, if wood invade the earth, we put wood on the top and earth on the bottom. Yeah. Correct? And here, look, we can see wood on the top. We just try to describe the situation, and earth on the bottom. So we go down, 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 and we go to the drawing number 74. Gexagram number 74, which describes wood affecting earth. Can you see that it has no stars? This gexagram, no stars. Why? Because it's not
good.
situation.
Not nice.
No, we don't like it.
Why? Why?
Because when
Why you don't like?
because when wood affect earth in acupuncture, in Chinese medicine terms, it's not good. It's just, it's invasion. That's why they come to acupuncturists or herbologists, because they feel sick, they feel nervous, they feel anxious, as someone said. It's not good. It's a strong wood affecting earth. It's killing the earth. And if you go to the description of Izin, by the way, you can go to the description. There are some websites when you can find the description of different, I think here, reading, but I prefer to read the book with the description. You can find it on internet somewhere in www. You can buy it. It's nice to read the philosophy of each and every hexagram, because it represents the world. It represents everything. It represents different situations which we can apply to Chinese medicine. So this situation, wood invading earth, resulted in the hexagram, which is not successful, is not good. So this is how we will talk about the elements, about the relationships of the elements. Let's say the kidney is weak. Someone has a patient with weak kidney, yeah? How would you, well, look, so the water is weak. How would you enhance the water?
Tonifies the metal.
You will invite the metal. Anything,
Yes.
yeah, that's possibly, this is the situation that we want to do. Let's write the Gua, the ID of the kidneys. This is the kidney ID, right? Kidney ID. By the way, who shares the same ID with kidney?
Liver.
Liver.
Liver. Very good. So, what situation we want to have? We want metal. Oh, sorry. No, yeah, we want metal to be stronger, so it will feed the water. Is this correct?
Yes.
Okay. So how we will, how it will look when we use the system of 64 hexagrams. So we need to put metal on the top
No.
and water on the bottom, because we want metal to be stronger on the water. You understand?
Yeah.
Metal on the top, water on the bottom. Okay. So how does the metal, where is the metal here? We have either young metal, which is heaven, 3 strong bars, and we have yin metal, which is yin on the top and 2 bars on the bottom. Yeah. Correct?
Mhm.
It's a young metal, bum, bum, bum. And we have yin metal, yin metal. And this metal must work on the water, and water we put on the bottom. This is young metal overacting the water, and water is only one. There is no other water. It's just one water is here. Okay. And in this case is yin metal on the top of yin water. Okay, can you see that? This is metal, this is water. This is young metal on the water, and this is yin metal on the water. 2 options. Okay.
Mm-hmm.
And we want to know which hexagram we will use, number 1 or number 2. Which hexagrams are better, which hexagrams are worse?
Better with the stars.
Better, more balanced. Balanced, more successful. Let's see where these hexagrams are on our table. What number?
61.
It's 61 and 62.
22.
Yeah. No one has a star, but maybe here we have some, because it's more. Yes. No, they don't have stars. Okay, we have to choose the best one. The general rule is to choosing the best hexagram is the combination of yin and yang. So one part is yin, another one is yang. Is better than yang yang or yin yin, because yin and yang create the balance at least. And also we would prefer the yin on the top and the yang on the bottom. Okay, the yin gua on the top and the yang on the bottom. This situation is on the bottom. Look, the yin gua, the yin metal is on the top, and the water which is young is on the bottom. So this diagram is 62.
One.
Yeah. Correct?
Yes.
62. We go very slowly, but then we will go quicker. And this is 61. This is young over young, and this is yin over yang. And now let's see how we would apply it to needling. The kidney ID. Let's see which line we will needle. Look, the number 1 line is the same, yes? Is yin line. What about number 2?
Different.
Yep. We will needle the line number 2. Oops. What about line number 3? Is the same. I'm sorry, I think there were 5 lines. Oh my goodness. Sorry, my fault. Okay, I missed one. It's number 6. So number 4 is different. We needle number 4. Number 5. And number 7, number 6. So let's see in antique points, which points are they? The first line relates to kidney 1. The second line relates to kidney 2. The third is 3. The fourth is 4.
5, 7,
7 and 10.
6, 10.
10.
Choose
So in
two,
this
four.
situation, we came to needing kidney 2, 4,
And 7.
7, and kidney 10. So if we needle kidney 2, 4, 7, 10, 4 points, we will initiate the situation in the body when metal becomes stronger and it overreact and move up the kidney water. Okay, that will be metal moving up the water.
Why you need kidney 10? Is because this was water?
We're analyzing, no, it comes from the Bagua. Look, there is a line, the young line, the whole line here, hexagram 61. And here we have the line, which is yin line. They are different. So
Okay.
we put the needle.
Okay.
Now, important, look, we go to the same kidney ID, the same, but we will investigate the next situation with the hexagram 62. Sorry, these lines are not very good, but you understand. So this is kidney ID again. ID, right? Let's see. Now, line number 1 is the same. We don't needle it. We don't change, because when we needle, we change yin for yang. Okay. Number 2, yes. Number 3 is the same. Number 4, yes. Number 5, yes, they are different. So it's kidney 2, 4,
and 7.
and 7. The famous 2, 4, 7. So you know why. And guys, this kidney 247 does an extremely good job. But you know where the energy comes from? The energy comes from the metal. And imagine you have a patient with asthma. You take the pulse, you see the lung is very weak and phlegmy. Weak and phlegmy, deep, very muddy pulse on the right sum. But you want to support the kidneys. And within your combination, instead of kidney 7, you need kidney 247. Will this patient feel better? No, because the energy comes from the metal and his lungs soon is weak. The metal is weak, the lungs are weak. And the patient feel worse. And then these people say, oh, balance method acupuncture doesn't work. It does work, but we shouldn't use this combination in this situation because there is no metal. How can we take the energy from somewhere that doesn't have it? In other situation, I had the menopausal woman with hot flashes, very strong hot flashes, very hot. So the treatment for heat, which treatment did I do? Hello? The heat treatment.
Tonifying water.
Yes. What is the heat treatment? Please remind me. Hello?
Liver, gallbladder, heart, small intestine.
Liver, yes. GB, what else?
Heart, small intestine.
Heart. And what on the left top corner?
Small intestine.
Small intestine. That's fine. So, conversion. I did the conversion and the patient felt better, definitely better. But the next, she came back in a few days, like in 2 or 3 days, and she said, you know what, it worked for like 1 hour. Because it didn't tackle the problem. The hot flashes and weak kidneys. So I added, that was a conversion. Yes, small intestine 3 and 8, heart 3, 7. Sorry, my writing is 3, 8 and 8. Sorry, that's 3 and 8, 3 and 7, 3 and 8. And gallbladder 34, 40.
One.
So we add kidney 2, 4, 7. No hot flashes for the whole day. Just very mild. She said it was tremendous difference. She came next time, again, kidney 247, plus heat treatment. And after 3, 4 times, I changed it only for kidney 7. Kidney 7. Why? Because kidney 7 will nourish the kidney water. It's a water point. Yes? But kidney 247 eventually at the end will exhaust the metal. You understand? If we always take the energy from metal, eventually it will become empty, unless it's very strong. Does it make sense?
Mhm.
Yes. So,
Yeah.
beautiful. Now you learn the main principle, what we do and how we work with 5 elements approach. First of all, we must understand, it's a rule. First of all, we have to highlight the meridian or the element that we're working, the meridian, and we write the meridian ID. You can write it down, just a rule. I think I have it. 5 elements, I wrote it down for you. So you can write it down. Sequence, just write it down, sequence. So rule number 1, point number 1, identify a sick meridian. In our case is kidney. For example, kidney deficiency. And write the ID meridian, the ID of the meridian. In this case is this one. Yeah. Number 3, work out the plan, what you're going to do. In our case, the metal will be on the top and water on the bottom. So metal will affect the water, okay? Will nourish the water. Step number 4, write down guas 3 grams. The metal on the top, the element. Now you write down the element, the metal on the top and the water on the bottom. It can be only 1 hexagram, it can be 2. In our case, it's 2 because there are 2 metals, yin and yang, and they nourish water. It can be more, it can be 4. 4 cases, okay? Number 5, you work out the best gua, which you will choose. In our case, it's either 61 or 62.
And is the best one chosen by the least amount of points?
Yes and no. Sometimes, for example, we will come to the cases when we have a choice, neither 1 point or 2. But sometimes you prefer 2 because you prefer the different situation.
Yeah.
So, but if your choice is 1 or 5, of course you will choose 1.
Yeah.
Great. Yeah. So in our case, you can choose both, but the situation when with the gua number 62 is better. Okay.
So why is that better?
Because the logic of the gua is better, is yin over yang. Okay. Here is yang over yang. Yang and yang. There's yin and yang. It's more balanced. Also, you can go to the gua description and read what it means.
Okay.
And this is very interesting. However, I wouldn't base my treatment on the description of the gua because it is very subjective. Sometimes we think this is good and this is not good. But but and also life shows that something which we consider as bad works very well for us. Yeah. So let's not become gods. And not to just, I try to avoid base, how to say, to avoid my judgments based on my ego or my logic thinking, because my logic can be wrong. Here, we try to base our judgments on eating, on 64 hexagrams, without just going further. So, this is the basic. Yes, and the last number 6, we work our needling. I wrote down this for you. This. And I think I will take a picture and send it to you later, okay? The working plan, like an example. Okay. Is it clear?
Yeah.
So this is the main principle. If you learn this basic thing, we are done. The technical thing, which we have to do like without thinking. This is a technical thing. But further, we'll go to more complicated situation, but the principle will be the same. We'll apply the same rule. Okay? Good. Clear drawings. Right. Now, let's see a different situation. Let's see the situation. When there is too much fire in the system, you have a patient who came to see you, and you understand that you have to cool down the system. So you have your Bagua, you have your 64 hexagrams. So what do you think? How can we cool down the system when there is too much fire in there?
Water or fire?
Water over fire. Okay, good. Right. So how many waters in our table? Just only one. In Bagua, just one water. Yeah.
Mhm.
And how many fires? There is
Also
only one fire. Yeah.
One.
The yin fire. Yeah. Agree?
Yeah.
Okay. So let's write down the situation which we have. What is step number 1? Just we'll go through the steps because I wrote it down for you. So we write the meridian ID. Yeah. So which meridian ID we're going to write? Which meridian are we going to work with?
fire.
Fire, right. Which meridian? We have yin fire, yang fire. What is the fire of the fire?
Yang.
We have, for fire, we have heart and small intestine, yeah?
Do I
Small
say
intestine is more yang of the fire, agree? So we write the meridian, the ID of small intestine, which is bum, 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 bum. You remember the small intestine is on the top, the line is on the top. So we double the ID because we need 6 lines. So it's small intestine. Okay. And which situation we want to to compare this gexagram with the water over fire. Yes. So the fire is this one, and the water just a sec. The fire. Just a second. Let me see. Yeah, and the water. Which gexagram is this? Which number? Can you look at it, please?
$36.
36. Okay. Does it have any stars? Yes, it does. Because it's a very good situation. It's a very good gua, right? Water over fire, when water controls fire. So let me tell me about the needling.
One.
Do the same,
Five.
with the same, with the same.
5 and 8.
5 and 8.
And 6 and was 6.
1, small intestine 5, and small intestine 8. Okay. So if your needle increase of fire, small intestine 1, 5, and 8, it will sedate the fire, but you know what you're doing. What you're doing? You take energy from the water to extinguish fire.
Mhm.
This is the situation number 1. You can use it by itself, just small intestine 1, 5, 8. You will hold the person down, or you can use it within the pattern. We will come to this later. Okay. But we have another situation. Situation number 2. What else can we do to extinguish fire? Mildly. This is strong.
Tonify earth.
What can we do?
Disperse the earth.
Pardon?
Disperse the earth.
Aha. Okay. So if we put the earth on the top, and the earth will act on the fire. You agree?
Mhm.
All right. Let's see what kind of gexagram we can use. Earth over fire. Fire on the bottom.
Temos 2 estrelas.
And earth on the top. Oops. Oops. Correct? So the top gua is the mountain. Yeah. And this is fire. Okay. So this is number 37. Right? And let's work out the needling. We write the meridian ID of small intestine again. We double it. Yeah. And let's see which points are we going to use.
Finally,
First is different. So we need the line number 1, which is small intestine 1. Yeah. 2 the same. Number 3 the same, and the rest is the same. So needling just small intestine 1 or bleeding it in any situation, even without doing a treatment, you will cool the system down. Just 1 point. Beautiful. For example, which situation it can be? Skin rashes, inflammation of the skin. I had a gentleman with all skin inflamed. So when you are not in the clinic, you are somewhere, you just bleed this point, easy, with anything, with just 1 needle. Just bleed or put the needle. Small intestine 1, easy, beautiful. And this is Dr. Tan's invention. No one did it before. What you do in 5 elements? Did you learn 5 elements at school? Yeah. Which point did you would you needle in 5 elements? Would you like me to explain you very briefly the traditional 5 element system? Very easy. Would you like?
Yeah.
You go through? Okay. So here we'll just stop. That was 5 elements of balance method. Yeah. Now we go to the traditional, which we learn at school. All right. But I would appreciate your kindness. I have to find the right cable for my drawing part. Otherwise, it will be very difficult to draw for me. And I will come up with my Picasso figures. Okay. So my suggestion is let's do the break. And maybe it will be up to 5 to 10 minutes. I will try to find the thing, but we will stay a bit longer after the webinar, okay? Because it's my fault. So, all right. So we have a 10 minutes break until, yeah, at 12, yeah, 10 minutes break. And see you after the break. All right?
Okay. Thanks.
Hello. Okay. Portion of this. Share. Well, to see you after the break. All right. So I will do. Wilma, can I ask you, do you have a picture or it's a view behind you?
I wish it was true, reality. I live in the Netherlands, so you have to have a little bit of a fantasy, you know, because otherwise it's not bearable.
It looks amazing anyway.
This
So.
is nice, huh? Yeah, very nice.
All right. Whiteboard. Okay, let's write down the oops, sorry. That's new share the whiteboard here. I was lucky to find a new share basic whiteboard share. Huh. Interesting. Okay, doesn't matter. Let's do it here. line. Okay, let's remember the antique point. Jingwell. First, it's a Jingwell. Why it doesn't work? Sorry. The screen. Share. Sorry, that's technology annotate. Apologies. Oops. Here must work now. Yeah. Okay. So Jingwell. Ying Spring. Shoestring. Jing River. And Hesi. So all Jingwell points are on the end of the distal. Then we go to Ying Spring. Then shoestring are usually in here on the wrist. Jing River slightly on the river, on the transition, and Hesi is usually on the elbow. The same about the leg. Okay, we come up from the toes and go to the knee. But there are two situations. The situation which is younger, and situation which is yin. Let's write it down. Okay, yin. Okay. So for young channels, Jingwell points start from metal. I'll just bring my model. So for the young meridians, for example, stomach 45 is the metal point. All young meridians, Jingwell points on young meridians are related to metal. So what goes after the metal? Definitely water. So Ying Spring relate to water. And then shoestring relate to wood. And then fire. And then earth. Okay? Clear. You just follow the circle. So we start for young meridians, we start from metal. Gallbladder 44 is metal, then 43 is water, then we go to wood, fire, and earth, GB 34. The same for stomach, the same for bladder, and the same for young meridians on the arm. Yeah. The yin always starts with wood. So all Jingwell points on yin meridians, lung 11, heart 9, pericardium 9, spleen 1, liver 1, what else is there? Gosh. Kidney 1, they relate to wood element, okay? And then we carry on wood, fire, for example, liver 2 point, which is the yin spring, relates to fire. So how we treat the fire? We needle what? Liver 2, for example, liver 2. shoe stream fire earth, Jing after river earth metal, and water. So kidney 10 relate to water is the last point on the knee. Spleen 9 relate to water element. Liver 8 relate to water element. The same as elbow points for all yin meridians. Okay, they relate to water element. All right. So what do we do with this information? And now let's think how we're going to tonify kidney. For example, if someone needs to tonify kidney, kidney is the water element. Yeah. How can we tonify the kidneys? We should needle the metal point so we can show the system which that we want the metal to be stronger to tonify the kidney. So what is the metal point on the kidney meridian? Kidney meridian is yin. Yes. Kidney meridian is yin. So
Jing river.
one relate to wood. Yes, on the bottom. Then kidney 2 relates to fire. Kidney 3 relates to earth, and kidney 7 relates to
Metal.
metal. Absolutely, metal. Metal is kidney 7. Interesting?
Yeah.
So we looked at small intestine situation, the fire situation. Yeah. So small intestine is the most fiery element, fiery meridian. Yeah. So what can you do to sedate fire? What did we do? We used earth element. Yeah. Earth. So if we enhance the earth, the fire will subside. Agree?
Mm-hmm.
Mindly. So what is the earth point on the small intestine meridian? Small intestine is the yang meridian. So we start from small intestine 1 as a metal point, and we come to the bottom to the elbow. Elbow is small intestine 8, right? So if you use the traditional 5-element system, you would needle small intestine 8 to subsidize the fire, and that will work because it's the earth point. So earth will subsidize the fire. But if you use the 5 elements of Dr. Tan, we came up with 2 situations. To use small intestine 1, or what did we do? We used water over fire, small intestine 1, 5, and 8. Okay, so this is the main difference between 2 systems. You can find this system on the books about 5 elements. But there is another approach, which is absolutely wonderful. It's also based on 5 elements, but it works so fast with the meridian pain. When the pain is on the meridian, you just needle 1 point and the whole meridian becomes absolutely
Relaxed.
well, relaxed, healthy, would say healthy. So, but I don't think that it will be the subject of this webinar, because we mixed up many things in this case. So that can be something else another day. So, but this is the classical approach, which you can use. You choose the situation within 5 elements. You see which element will go on the top, and look the number of the antique point, and you just use it as we did with small intestine 8 and kidney 7. Okay, but if you do 2, 4, 7, you know that it goes from the metal. Be careful with that. Okay, right, is it clear? Not 100%, but at least we tackle the system. Okay, good. Clear all drawings. Now let's go to another situation. This situation, I based my teaching on the real case studies, so you will know how to proceed with the treatment if we go through the symptoms and so on. So we go to more complicated stuff. Are you ready? If we can apply this method to one particular meridian, as we did with small intestine, as we did with kidney, we can apply the whole situation to the pattern of balance method, or Tai Yin Yang Ming, or Ju Yin Yang Ming, or Shao Yin Shao Yang, any pattern. Yes, it will be slightly more complicated, but let's see what it can be. Let's go through the situation. Or maybe not yet. We'll just go through one more case. Okay, when you come, when someone comes with digestion problem, bloatedness, for example, which is very common, slow digestion, overweight can be, the reason can be different, but you find out that the reason is that the stomach is not working properly. What is the stomach not working properly? It's well, imagine the stomach is just the bag surrounded by muscles. So these are muscles with blood, and there is food. Okay, so the muscles must be healthy. So they have to work, they have to do some work, they must move properly, have a good tonus. But imagine that these muscles are so weak, they don't work, they don't contract. Moreover, have you ever bought the stomach from the meat shop, like sheep or cow stomach? I used to buy it for dogs. I feed them. The puppies, they like stomachs. They become stronger. That strengthens their digestive system. So you may find out, if you did it once, that the sheep stomachs, they covered by fat here. There's a lot of fat here. So it's like a layer of the fat. So if the muscles of the walls do not contract, there is not enough blood supply in the muscles of the stomach walls, they are very flaccid. The stomach becomes fatty, has a fatty wall inside. And whatever you put inside of the stomach, the walls do not absorb anything. It just stays there. And there is no fridge there. It's just become rotted. So the stomach, the healthy stomach, becomes a lazy sock, like a lazy bag. It doesn't absorb. It doesn't do the job. It doesn't contract. It's just weak. It's not healthy. This stomach will have a very weak and jelly pulse. So you press and it doesn't rebound. You press and it stays as it is. But you have to press at the right point. If you listen to my free introduction, you may remember the rule of the fork. That must be the gap between the first position and the second. Because if you try to use 2 fingers together, you put 2 fingers together, in between you will feel not the stomach, but you will feel the place where the heartburn shows. Usually you can on the bone, on the styloid bone, you feel the heartburn. It's mainly the chest and yeah, there. So in order to feel the stomach, you have to be on the other side of styloid. And when we press and the pulse is weak, it means that we have to enhance stomach and spleen because it's a couple. Right? So the assignment is to enhance spleen or stomach. What we do in Chinese medicine. According to our drawing, stomach is a yang meridian. And if we needle stomach 36, it's an earth point. Yeah. It's an earth element. So earth will tonify itself, right? So we tonify the same element within the system. This is the traditional one. Okay. Within 5 elements of balance method, what can we do? If we say we tonify, let's not tonify stomach. Let's work on spleen. It's more interesting. So the spleen. We want to tonify spleen. What do? We'll found out the meridian that we want to work and what is the spleen ID. Spleen ID is the veggie sandwich. You remember, yeah? And what situation we want to have to enhance the, to make the earth stronger. We can enhance fire, yeah, make it stronger, so it will make the earth stronger. So that will be the situation, the fire over earth. But we have 2 fires. One is yang fire and another one is yin fire. Look at the at 64 hexagrams, please. We have 2 fires. Yin fire Oh, sorry. We have two earths. Fire is always yin. Yes, fire is always yin. We have two earths. One earth is the hexagram number 83. This is yin yours, earth. Yeah. So it's 83. And this is the yin earth. On the bottom. And fire is also yin. Yeah, correct? Yin fire on acting on yin earth. And another hexagram is 73. Which is in fire acting on young earth. And this will look like this. Is this correct? Are you following me?
Yeah.
Only one yes. So it's a voice of the group, I believe.
Yes.
Okay, good. All right. So for the situation number 1, when yin fire acting on yin earth, which points we have to needle? This is spleen. Number 1 is different, so we needle the yao number 1. Number 2 is the same. Number 3 is different. And the rest is the same. So this is spleen 1 and spleen 3. 2 points. Okay. So this is situation number 1, when we make the spleen stronger. And situation number 2, okay, we'll write down the same ID. This is spleen. Yeah. And let's compare it. The destination Gua is number 73. Look, the Yao number 1 is different. Number 2 is the same. Number 3 is the same. Number 4 is the same. 5 the same. 6 the same. So this is only spleen 1 that we needle to move the earth up. Interesting. Ladies and gentlemen, look, if we move this, if we needle the spleen 1, we make the earth stronger. But please remember, these treatments are very strong. 5 elements treatments are very strong. You just, it's like a tractor or big lorry. So if you want to apply this, you need to be sure that the stomach is weak and this person has enough fire to move the earth. So want to repeat, you can use once, you can use 2 times, 3, the 5 elements. So you can needle spleen 1, first treatment, second treatment, third, but don't do it too many times, because when the spleen becomes stronger, just drop this treatment. Use stomach 36 or something more traditional. okay, conversion, well, whatever, acupoints. Because 5 elements in balance method is the invasion into the system. You use the wisdom of Bagua, but you don't rely on the balance of Bagua. So you
One
need to
question.
create
Excuse me.
balance. Again, when we do the meridian conversion, yes, we kind of put everything together, we realign, we do everything together. When we, so we use 100% the relationship of the Bagua. When we use Ashi points within the balance method, it's also Bagua, we use Ashi, we use the wisdom of the body.
Mhm.
But when you decide that fire will override the earth and I want the fire override the earth, I use my ego. You understand?
Mhm.
To make this decision, I use my wisdom, I use my, well, whatever is me. Based on Bagua, yes, it will work, but the decision is mine. You understand?
Mhm.
This is the difference. Okay?
Can I ask? I've used Moxa on spleen 1 to stop bleeding, and that's worked well. But just trying to understand it from this.
I don't do this. Stop bleeding
Okay.
where?
Like menstrual bleeding.
You can make it even worse. I'm sorry.
So it's helped though.
Sometimes, no, you can make it worse. In some situation, it helps. In some situation, it doesn't. I can give you the example of my failure. Years ago, I had lady with anxiety, and I didn't know how to read the pulse, and I didn't know about the ear. I just thought for some, well, for using the tongue diagnosis or whatever, I decided to use Moxa on stomach 36. And that was a disaster. Because later I understood that the reason for the anxiety was the stomach heat.
Ooh.
The stomach heat, everything in the fire. So I used Moxa on the stomach 36, and that was a nightmare. So I do remember it. We remember our mistakes. Very good.
Yeah.
So so with Moxa, again, we have to be sure that we do the right thing. Moxa is strong, is beautiful. I like Moxa, but sometimes it's right thing to do. Sometimes if there is a inflammation there, so you may not use it. So it's very individual. You have to be sure.
And we use one spleen bilateral or in just one.
You can do bilateral. In balance method, I avoid bilateral needling because I personally like this yin yang yin yang. I feel myself better when I do this. But some people do bilateral, it's fine. But again, the acupuncture balance method is so successful in local pain. It's very good in balancing the system in global balance. But there are other methods. So what I try to, when I learned balance method from Dr. Tan, we all learned that the balance method is the top, is the best, and nothing else is better. I want to say that if you know the truth, there is no way to develop yourself. So there are other ways of doing acupuncture, great ways, and some of the ways have not been discovered yet. So balance method is good, but it has its own limitations. Learning, but the more knowledge we have about the subject, the wider we can apply this knowledge, and we have more options to treat the patient. That's why we have 5 elements and seasonal balance after the break. So, yeah, I will give you the basic treatments that I use in 5 elements more often than others. So they will be 7, 6, 8, 9 approaches that I would like to share with you today. And the rest you can design yourself, because you will know how we do it. Okay, so let's go to the next. Yeah,
Can I please ask something? In regards to, say, like the spring points on the young channel.
which point?
The spring.
Mm-hmm.
On the young, they are water, and so I can relate to that. Would be have a cooling effect.
Young water. What? So sorry, I didn't. I can't hear you well.
On the young channels.
Yes.
The spring points are water element.
Mm-hmm. Yin spring, you mean? Number 2.
Yeah.
Yeah.
And on the yin, they're fire. And like I'm thinking about like liver 2, I use quite a lot for cooling and for eye irritations. But I'm just trying to think, why does it work if that's a fire point?
Because we used to the system that I explained to you in 5 elements. It's one of the approaches that explain the phenomena. Okay, in this case, liver 2 is fire point, and we needle the fire to strengthen the system, I believe. We think, my vision, we think that liver is overacting, is too strong, but in reality, the liver is weak. It's a gallbladder which is strong.
Right.
So we need to strengthen the system. On the other side, if we use the liver 2, we increase the fire, so we'll pacify the wound. Are you with me? Yeah,
because it's the child of wood, isn't it?
Yes, yes.
Yes.
It can work this way. So liver 2 is a beautiful point. It will always work well. But in other system, if we make a webinar, a short one later on, I will explain a different approach why liver 2 will pacify the whole meridian.
Okay.
But it doesn't based on the 5 element system, the traditional one. I don't want to confuse you.
Okay. Thank you.
So it just comes down the whole meridian. That's why it works. But there is no explanation of this phenomenon in traditional 5 element system. Okay.
Cool.
Right. Clear all drawings. Well, let's see what else we can do. I will give you this system, the symptoms. For example, just another situation, I had a patient with burning diarrhea. And I used small intestine 1 to sedate the fire. I didn't treat diarrhea as such, but the patient felt much, much easier straight away because it works very fast. The 5 elements balance method works very fast. That's it. So small intestine 1. Okay.
You use one of small intestine, for example, a person who has hot flashes,
Hot flashes, yeah.
for example, yes.
Yeah. Okay, let's do this situation. Heat condition. We have small intestine, hot, small intestine, hot, liver, and gallbladder situation. Yeah. It can be skin rashes. It can be, well, infection with fever. It can be, well, anything with heat, hot flashes as well. Let's think, what can we do to decrease the fire in terms of 5 elements? What kind of situations we can have? We can either use the situation water over fire, or we can increase earth so it will extinguish the fire. Okay? I want to say that this situation, earth over fire, is more gentle than water over acting fire. Right? In general. Right? Can you see that? So let's go for the method. So how we work it out in the situation of pattern, balance method pattern. First of all, we write the ID of each meridian in this situation. Small intestine, this, heart, ID, liver ID, 16 bars, and GBID, all 6 young bars. Yeah. And now let's think. Oops. Which situation we want to work out first. Let's do water over fire as the milder one. Yeah. And let's see what kind of hexagram we're going to use. 36 is the best. You can see 3 stars. Oh, sorry, not water over fire. Water over fire, let me see. Yeah, 36. Yeah, right. Water over fire, the strongest one. Yeah, not good. So what is 36? Let's write it down. 36. That's 3 stars. Yeah, 3 stars. Because it's really good.
What did the stars represent on the on the chart?
One, it's just it's the latest inventions. Actually, Dr. Tan, the numbers on the traditional I Ching table are different. These are the numbers of traditional I Ching. Can you see? They are different.
Yeah.
And we all know that. And this is the wisdom. What Dr. Tan done, he just put all the numbers in the just in the order 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So for us to find easier the right hexagram, I think. I don't know whether it was right or wrong. Among these hexagrams, some hexagrams are more successful, are the best of the best. For example, the hexagram 18, the hexagram 45, 54, you will see 72. They are considered the best because they represent the best harmony, the best description, the best balance between themselves. So this very favor situation. So if you want to apply, choose the hexagram with more stars.
Okay.
However, the choices of Dr. Chao Chen, who invented this method, were different from Tan. Tan put stars on some hexagrams and Chen put stars on other hexagrams. So maybe your stars will be different.
Okay.
So it's a good field to research. Because if we do something, it's nicer to do. It's not because someone else did it, but I do it because I think that this is the best, not Dr. Tan. Would you agree?
Cool.
Even it was Dr. Tan, but well, never mind. So did I explain it well? So 3, we downgrade 2 stars, 1 star, but it's subjective. Anyway.
Okay, thank you.
But anyway, we look at the amount of the stars as well. Let's base our judgments on this system until we came up with our own system. Okay. So hexagram 36, how does it look like? It's water over fire. On the bottom is fire. And on the top is water. But interesting enough, if you look for the description of hexagram 36 and Idzing, you will find out that it's complete harmony. It's one of the best hexagram in Idzing. But if you change it for fire over water, that would be one of the most unsuccessful hexagrams if you turn it upside down. So be careful choosing a right hexagram. It may not be right, so we can rely on the stars. Okay. Okay, so we apply 36 to each and every ID. And let's see what will happen. Let me change the color, the right, and let's see which lines we will needle in small intestine. Number 1 is different, yeah. So 1. Number 2 is the same. Number 3 is the same. Number 4 is the same. Number 5 is different. And actually, we already saw this situation. You remember? We went through this before. Let's apply number 36 to the heart. Number 1 is the same, number 2 is different. So it's heart 8. Number 3 is different. Number 4 is different. Number 5 is the same. Number 6 is the same. So 8, 7, and 5, right? For the heart. For the liver, let's see which one are different. For the it's number 1, number 3, and number 5, which is 1, 3, and 5. And for gallbladder is number 2, number 5, and the last one. They are different. And the points are 43, 40, and 34. 43, 40, and 43, 40, 34. Okay. So this is one situation. When we enhance the element of water, which will act over the fire. When kidneys are strong, so they can act over the fire. If there is no kidney pulse in the patient, if the patient is on dialysis, and you know there is a kidney problem or well, whatever, don't use it. Because kidney has no energy. But if, for example, when someone is menopause, having menopause, kidneys are weak. Maybe, usually menopause is weak kidneys, right? But, for example, the young man, 18 years old, having skin rashes or situation with well, any fire situation, heat situation, temperature, fever, his kidneys, I would say, will be stronger than kidneys of menopausal women. Would you agree? Yes. So for 18 years old young man, or for the woman, or young, strong, that's fine. For exhausted kidneys, definitely no. Okay, so another situation is to strengthen the earth. So it will overact the fire. Okay, let me erase, or maybe we will draw. Are you following?
Mm-hmm. Yeah.
Okay, so our work is very academic. Yeah. Now, so which hexagram is this? Earth over fire is 37. Okay.
Okay.
How many stars it has? 37. 2 stars, so it's good, still good. Okay. So would you like it to do yourself, just for practicing? I will do it for you, but I will do it in silence, and then we can compare it. Okay. How are you doing?
Fine.
Good. All right.
Oh, yeah.
Ready?
Yes, just.
Okay, let's wait a bit for the rest of the group.
How does it work for you in clinic? Have you got it all in your head, or do you work them out, or?
Do you mean, say it again, please, Mark.
If you're trying to work out a treatment for somebody, is it because you've got the experience that you just know what the points are now, or would you still sit down and work it out?
No, look, the main situations, sometimes, this is the beauty of it. Look, you have your situations that written down in your script, which you know. Like, for example, we have already small intestine 1, which you remember. We have kidney 247, which you remember. We have small intestine 158. We went through already. We have spleen 1. We have spleen 1 and 3, and so we have some, and we will learn more. And I will give you some more information, and I will give you another handout, which I didn't send to you, especially because I didn't want you to give the information before we worked it out. Okay, it's very boring.
Yeah.
Yeah.
Oh, yeah. So.
But if you come to the situation that you want to figure out, you can always work it out through the bar.
Great.
But main situations, main patterns will go through.
Cool.
Okay, so it's like in the exam, you know how to do the equation, but if something you have to go and dig it out, that's fine. So, okay, what we have? We have small intestine 1. Yes, we have nearly all heart points. Is it the same as you? We have liver 1, 3, and 8. And we have 3 points for gallbladder, 43, 40, 38. Look.
But
Is this correct?
Just not heart 9, is that correct?
No, let's see what for 37 is 2, number 2, number 4, number 5. Number 2 in gallbladder is 43. Number 4 in gallbladder is 40 and 5, 38. Should be right. Should be correct. Yeah. Okay. And now I will give you the trick which we use. Look, you won't use this possibly. No. Right? Because too many points. What's the reason? So you can, for example, use you can use combination of 2 guas. You understand? So we can choose small intestine 1, 2 needle small intestine 1. Yeah. We can choose 2 needle heart 578 or 875 because it's less points.
Ah,
Instead of all heart points. Okay. It's up to you. We can use like liver 138 or 135. It's up to you. So you have your choice. That will all work. Ideally, you use 2 meridians from 1 hexagram for 1 hexagram and 2 for another hexagram. So you can use, for example, heart and liver from hexagram 36 and small intestine and gallbladder from hexagram 37.
mhm.
You understand? So
Yeah.
your treatment will be liver 1, 3, and 5, and heart 5, 7, 8. This is from 36, 36, 36, and you will use small intestine 1. This is from 37, and GB 43, 40, 38 from 37 as well. And then it will be balanced diagonally. Interesting.
Yeah.
And the most interesting thing that it works so fast. You can use conversion. Yes, meridian conversion. But this is even stronger. So it's like a good extinguisher. Very advanced, the last generation. So we kind of advanced balance method allows us to use stronger treatments. This is for a really strong fire. This is for strong fever. Okay. It's not just I will use it, okay, because the tongue is red. No, don't do this. You will destroy the system. Don't do this. Okay. Let's go through one wood treatment and then we'll have a little break. Okay.
Yeah.
By the way, in the previous treatment, we have 2 choices for earth over fire. Another choice was the guar number 38. We didn't mention it. Why? This is in earth, over in fire. Fire is always in. There is no star on this hexagram. It's yin over yin. It's a weak hexagram. There is no much balance. It's a situation. You can read about this hexagram, by the way. So we just decided not to use it. Okay? But you can work it out. That will be different points. Yeah. Oh, all right. So, patient came with insomnia, keep thinking about the day, intrusive thoughts, overthinking, tension in GB21, easily angry, bitter taste in the mouth, time to time, and also like a metal taste in the mouth. Discomfort on the side after eating greasy food, lateral discomfort. And constipated, quite honestly. The liver ache is very tense, painful when whilst palpating. And you know, if liver ache, Dr. Tan, this pad, yeah, is painful, it means that it is a wood problem. What do you think about the approach? How are you going to approach this patient? What kind of treatment are you going to give to her? In terms of it's local or global? The first question.
Global.
Global. Okay, which pattern do you think you would use? The pulse when you touch the left guan is very wiry and strong. The side of the tongue is red, are red.
Jiu Yan Yang Ming.
I think for Yang Ming pattern, it's this description is already strong. We can see that this is the liver is very strong.
Yeah.
For Jiu Yang Ming pattern, can I give you the description more or less about the patient? Patient came a bit fearful, warrior. They are warriors. The liver pulse is tight, wiry, the same tight, but not very strong. Okay, a bit of digestive problems with gastritis, slight bloatedness, anxiety, but this is more fear. But the description that I gave you in the first place, they are more liver people. The sides of the tongue are red, the liver pulse is pounding, they all on the sides. GB21 is painful.
Shaoyan, Julian.
Yes, Ju Ying, Shaoyan. Agree?
Yes.
Ja, GB, pericardium, liver. And because, listen, because the situation is very strong, I decided to use the 5 elements, but not only because very strong, but I see that the liver element liver is overacting. It's too strong. I have to work with the element. Okay. So what kind of situation, what can I see in 5 elements? So the wood is the problem. Okay. How can I pacify the wood? I can either increase the influence of fire over wood. Yeah. This is one situation. Another situation, for example, what can it be? It can be metal of wood. Yes.
Yeah.
So that will be like this. So for the situation number 1, when fire will extinguish wood, which hexagram you would choose? Give me the number.
Forty-three
43.
43.
or 53.
What else?
53.
53. What else? Anything else?
No.
Right. To avoid too much work, let's see which hexagram is better, 43 or 53?
43.
43.
Because it's yin and yang.
Yin and yang. So we choose 43. Okay. My suggestion is, let's use 43 for Sanjiao and for gallbladder, for example. I will tell you later why. And let's choose metal over water. Which hexagram we have? Let's see, what's metal over water? Is 41. Yeah. What else? 51. 42, 52. There are quite many. Which one would you prefer? Just look at them. See whether they are balanced enough, whether there is yin and yang, there where yin is on the top and yang is on the bottom. This is another situation which makes it better.
When you talk about choosing which is the better one, I'm a little bit confused about not knowing what to look for.
First of all, look at the stars. Which one has stars among these 4?
Oh yeah, I got that. But in terms of like being able to work it out for myself, like the yin and the yang.
Right. Look, first of all, you have to read the description of the gua. Read it in its thing. You will pick up the main sense, because some of the hexagrams, it's just end of everything. Death. Well, good, because after death, we resurrect and we live again. Yes, theoretically. But for the patient, it may not be good. So you would try to avoid this gua. Correct?
Yeah.
Yes, so you can read the description. So these guas, these hexagrams, are without stars in the table. They were crossed, Dr. Tan and Chao Chen, they didn't put the stars in this glass because it's not good for the patient to die, okay?
Yeah.
Or for any other reason. Some gigagram, they show the difficulty in going through something, the fight. You wouldn't impose this information on the patient because every gigagram is the information. It's like a matrix that you apply on the meridian. Either you apply success, health, and growing, or something else, right? So it's an information. And then information is subjective. So answering your question, first of all, read the information in general. Don't go in many details, but reading, you will see whether it's good or not already. Then see yin and yang. Better guas have yin and yang, either on the top or on the bottom. So the combination of feminine, masculine, yin and yang. Among them, those who have yin on the top, yang on the bottom, are better.
Yin on the top better.
Yes.
Yeah. Cool.
Yeah. So we have this situation, and let's write, sorry, we didn't choose the right one. So among them, 41 has 1 star. 51 has no stars. 42 has 2 stars. And 52 has no stars. Let's cross out these 2, okay? Otherwise we'll think too much. So let's choose 42. Someone put 2 stars, and this someone was Dr. Tan. So let's respect his opinion. You can go to 41. So let's do 42 here. Okay, 42 here, right? And let's write the ID of each. Oops. And GB. Okay, have you done it? It's nice to remember the IDs. So you can write down the code. This is a code for the meridian. We're like programists. We program the meridian. We can program it on the balance. We can program it to make one element working on another element. So we're really IT managers. We work with matrix. And this is so interesting. So let's write down the 43. 43 looks like
You're going for 42, weren't you?
Fire over water. Oh, sorry, fire over wood. I'm sorry.
Yeah.
It's a fire. And this is wood. Okay. So let's see what changes in the needling. What do we do with needling? It's 1. The same. Number 3. number 4. That's it. Sanjiao 1, 3, 4. Correct. And let's work out the Gua number 43 for gallbladder. It will be line number 2, number 3, and number 5. And that will be gallbladder 43, 41, 38. I think we went through this already once. And number 42, the hexagram. Is metal over wood. Yeah. Oh, sorry. What's wrong? Okay, so for the liver, we'll need a liver 1, liver 4, and liver 5. And for pericardium, we'll need just pericardium 8. Just 8. So this is the situation. And actually, if you apply 2 guas from within 43 and 32, you you invite more elements into the system. This treatment works very well. It pacifies the system, okay? It sedates the wound nicely and strongly, but you have to be sure this is the wound problem. Okay? So in our class of wizardry, can I say this? Like being in the world of Harry Potter for so many years, I think we may associate ourselves with wizards. But every wizard, it has the system that they learned in the school. It looks like magic, but behind any magic, there are certain actions and certain knowledge. So, yeah. Please, now, very important, tell me the difference between 2 approaches, Jiu Yin Yang Ming and Jiu Yin Xiao Yang, the main. Okay.
With Ju Yin Xiao Yang, you have more problems on the sides, more lateral, and with Yang Ming, you have more in the front problems.
Brilliant. Yes. Good. Anything else?
There's more tension. With Ju Yin Xiao Yang, you have more tension.
Yes.
More liver.
Right. Correct. What about the sleep? The difference in the sleeping pattern? How do the people sleep in general?
More restless in Ju Yin Xiao Yang.
Absolutely restless. Wake up quickly, many times during the night.
Yeah.
And these people, Zhu Yin Xiao Yang, they don't sleep. They just don't sleep. They wake up and they don't sleep. Or they don't sleep and then they go to sleep. So they don't sleep for a certain period of time. So these people needs to be tonified, the Zhu Yin Yang Ming in general. But these people, they need to be pacified, Zhu Yin Yang, Xiao Yang. Agree? In general. When you apply 5 elements to Zhu Yin Xiao Yang, you have to be sure that this situation is strong enough, and this is a liver. Not 5 conditions, and liver is one of these. No, this is a liver, and I work with liver, with wood. I'm sorry, not liver, with wood. Okay? Good. So, any questions related to what we're doing now? I can see that you follow. Yes, good. So you kind of you can grasp the logic and you can work out the thing. We find the pattern, we find the best hexagram, and we apply the situation to each and every meridian in the pattern. Okay? Very good. So let's say goodbye for 25 minutes.
This is the same with the conversion meridian. We don't need to add more needles in the meridian we work with.
No, no needles, unless it's the external meridian. You remember I explained the heat treatment? Clear all drawings. Heat treatment. We did conversion or whatever, and then we added kidney 2, 4, 7 to strengthen the kidney for hot flashes. Works great. After 5 times, you change this kidney 2, 4, 7, or after 3 or 4, I don't remember, it doesn't matter. When it pacifies the whole thing, you change it for kidney 7, which is mild, because that will take from the energy from the metal. And when the metal becomes exhausted, it has nothing to give. So with kidney 7, you take energy from another source. Okay? But it has to be external meridian you add to the pattern. All right? Great. Okay, see you in 25 minutes.
Okay.
Nice.